So a lot of women would choose to go to the hospital for two main reasons, I would think. One is that they're scared that something might go wrong, and the other is that they want drugs for the pain. So can you share your thoughts and feelings about those, and how can we ease a woman's fears a little bit?
Well, when I meet with my moms, I always find out possibly what their fears may be in front of birth, because that hinders birth. I like to find out if there's been trauma. I like to find out if there's been anything in their lives that they're scared of or that they need to deal with before birth, because fear blocks birth. And then I talk to them and I give them information of the pros and cons of both. I let my families make their own decisions, but I am very well-rounded. In fact, this is the pros, these are the cons. Then if they have any questions, we can discuss it more. I sometimes even have it discuss it with the doctors, and the doctors have been really great about being open and honest about the medications and so forth. There are those chances. I also look at them and I just really think, what are you looking for in your birth? Are you looking for pain-free, easy, do you need me in that situation? Really, I ask them, because usually with that, there's really not a lot of complications. It's pretty, I lay back and everything happens. But I really look at the reason why they're wanting drugs. Are they wanting drugs because of the fear of the pain? Are they wanting drugs due to the fact that they don't want to feel anything due to trauma? And then I think about, okay, well, how can I make them understand that we could possibly work on different things? We don't have to have drugs right away. And I tell them the different techniques we could possibly use. And I really look at, them to make the ultimate decision, because I don't do that. But I want them to have a well-rounded understanding of what the pros and cons are of their decisions and that.
Good. Erica?
Yeah, so I would never try to convince somebody to have a home birth if it was not something that they felt strongly about. I really feel like the best counter to the fear is simply information. And a lot of times what I see is people won't come and interview me if they have no interest in a home birth, but they might have some reservations still, or more than likely, it's usually the partner who is a little bit afraid. And so I really feel like research, do some reading, read up on studies, see what they have to say about the safety of home birth, look at my credentials and my training and understand where I'm coming from in my abilities to serve families. And that often clears it up for people. And if not, then I completely understand that, and they have to have their own journey. As far as the pain medications go, sometimes they can be useful tools, and as long as people understand that there are risks involved in any sort of intervention, that there's benefits, but there's also risks, and one of the big ones is just the cascade of interventions that we talk about a lot in the natural birth world, that, you can't just pick and choose a la carte options. If you get an epidural, you will need continuous fetal monitoring. It's a requirement because not all babies do well when their mom gets an epidural. They will have to be hooked up to a blood pressure cuff, because a lot of times an epidural can cause the blood pressure to completely tank out on the mom, which can of course cause problems with the baby. An epidural can cause a fever, which then can cause the baby to need to be monitored more closely, because it's very difficult to tell, was that fever caused by the epidural or was there an infection setting in? If an epidural is given quite early in labor, then it can slow labor down, so Pitocin might be required. So you can see how you can't just have one thing, but a lot of these things get tied in with one another. And so as long as a woman understands that and feels very comfortable about those options, then it might be something that she wishes to have. And of course, at home, we don't do that.
What about the concern that women have about the mess that's going to be created in their house?
Sure, and that is a really common question that I get asked by almost everybody. Birth is actually not nearly as messy as what TV and movies have us believe. And as a home birth midwife, I am an expert at laying out waterproof tarps and absorbent underpads. The vast majority of time, After a baby's been born and everything is kind of tidied up, usually I have like 1 bag of laundry to do and 1 bag of trash to go out, and that is it. And then I break down the pool if they used a pool. You know, I drain the water and everything. And by a few hours postpartum, when the extended family comes to visit and meet the baby, I often get grandparents who look around and they go, "Where was the baby born?" Because it just looks like the family's living room again. And so really the mess, it's something that I'm very used to just taking care of, and there's often no signs that anything happened within just a few minutes of the baby being born.
Very nice. So now, maybe not a lot of viewers have heard of delayed cord clamping. Is that something that you ladies recommend?
Yes.
Okay. Do you want to just touch on that a little bit?
I let my families know the options of what's best for the baby. And what that does is it takes the blood volume from the cord and lets it go back into the baby, which sometimes there's enough there, not even need a transfusion at times. There's some there also that like the infections and things, that there might be enough blood to build the antibodies that the baby needs, and it's just it's supposed to be back into the baby. And so if you ever look at the 2 different cords, even after that time, there is a huge different amount of volume, and then the cord shrinks down to almost very, very small, and all that blood and all those needs have gone back into the baby where it really, really do belong.
Yes, in my practice, it's just standard that I do delayed cord clamping. There's so many other things to be paying attention to rather than the cord at that time. And it does continue to pulse for quite a bit of time, and it's a give and take. So it's not that all the blood will rush to the baby, but a little bit goes back, and then a little bit more goes to the baby, and a little bit goes back until that process is complete. During that time, that baby is getting blood that contains oxygen. It makes it a little bit less of an urgent need for them to start breathing on their own, so they can transition a little bit more slowly.
Oh, very nice.
It's especially helpful in a case where a baby needs any extra care to get started breathing, if they need any resuscitation or just extra stimulation, to know that they are getting supplemented by their cord while it's still intact.
And you know, if we just look in nature, animals don't have someone there waiting to clamp a cord. It just happens naturally.
I believe that our bodies were not so poorly designed that we require somebody to immediately clamp that cord with a dirty shoelace in order for the survival of our species.
Right.
I guess the biggest thing is, if you're hiring a doula, to really look into it. If you have any questions, still contact them. Let them know what you're looking for. Even if you don't want necessarily a natural childbirth, they still are great to be there to help you through transitions of different drugs. If you have fears of different drugs, they're just really good reassurance to be there. They're also good there for the partner to teach them how to be reassuring to you too, and just to let you guys be a team as much as possible. They are a great asset. The other thing is that if you go from a regular birth to a C-section birth, you're looking at a $3,000 to $5,000, depending on where you live, increase in your bill. And doulas have been really good at not having to do that, helping you not have to reach that, and to save you some money. So even though it seems like a lot of money in the beginning, if everything goes as planned, you usually are saving a couple thousand in the end.
Wonderful. How about sharing your contact information with the audience so they can get in touch with you?
You can reach me at Birthing Miracles, yolasite.com. I'm also on Facebook. I'm also on DoulaNet as one of the doulas that is an option in our area. And my phone number is 507-469-0176.
And do you have any days, if someone's just calling for information, do you like people to just call during certain times?
If you could call between the time between 9 and 5 is appreciated, but if you have any questions, I really am open to serve you.
Okay. There you go.
So my website is erikaurban.com, which is ErikaUrban. I am also on Facebook under Urban Birth. My phone number is 507-934-4820. And as far as hours to call, it is our home number. So if it's not 2 in the morning, that's always good. But any time is really fine.
Okay. And And I will have their contact information down at the bottom of the video. Thanks again, ladies. I appreciate you coming and sharing your information.
Thank you. Thanks.